Okay, we're going to be doing skill 13-15, providing care for the client with an endotracheal tube, okay? All right, so we're going to gather our equipment and supplies. So you're saying, what kind of supplies do I need? Well, you need a suction tubing with a yank car. Make sure it's connected to your suction canister and the suction machine. Oh my goodness, you know what I'm talking about. Okay, so then you need swabs and toothbrushes that are to be used with suctioning. You're going to need gloves and you're going to need a stethoscope. Okay, so we gathered our equipment and supplies and we performed wipes up with a client with an endotracheal tube. You are going to monitor breath sounds at least every 4 hours, okay? At least. You're going to check mark points on the tube at the insertion level. So you're going to look at the tube and you're going to ascertain where the ET tube is sitting within the mouth or the lips. So this one would be 19 at the lips, okay? And that's important. You want to know that, okay? You're going to inspect the positioning and stabilization of the tube. You're going to make sure that it's still stable, that there's still some air in the balloon, which is in the trachea. You're going to inspect and clean the mouth and nose. You're going to observe for pressure areas or ulcerations. You're going to provide suction toothbrushing every 12 hours, oral swabbing every 2 hours, and oropharyngeal subglottic suctioning every 6 hours. Okay, so they make these nifty little devices now that look like the mouth swabs that you would use just on non-intubated patients. But these have a little hole in them, okay, and a thicker tube with a suction device connected to it so that you can actually be swabbing, and if you feel that they've got too much liquid in there, you can suck that liquid out, okay? They make them with a toothbrush on this now too, so you can actually brush their teeth, okay? So you use that by connecting it to the suction tubing like this and going in and swabbing the mouth. Now you don't put your finger over the hole unless you want to suck, okay? All right, and these are made so that you can do oral care as well, okay? All right, oropharyngeal subglottic suctioning every 6 hours is accomplished by your yank car. And you're just going to go in beside the cheek into that subglottal space in the back and suck out the excretions, phlegm, whatever that is pocketed back there, okay? And then you're going to reposition the ET tube every 24 hours. So that's as simple as making sure you have a hold of the ET tube so it's not moving in or out. And you're going to manipulate the holder and the tube to right, center, left. You're just going to rotate them, okay? So it's as simple as that, okay? You just reposition. Why do we do that? We don't want any breakdown happening on the lips and in the mouth and anywhere on the mucosal lining, okay? We're going to support the client's head and tube when we're turning, okay? Definitely, definitely. If you've got an intubated patient and you're rolling them, you always want to have somebody that's watching that tube and watching to make sure that, you know, nothing happens to that. You're going to place a call bell within reach and provide alternative means of communication when the tube's in place. So if this patient is intubated and not sedated, that means that they still want to tell you that they hurt or they're cold or, you know, whatever. So they need some sort of way to talk to you. So a whiteboard with a marker on it is great. They have these picture cards that they can point to. They have word cards that says cold, hot, doctor. Some say have to urinate or have to poop or whatever it is, produce stool. So they just point to the word and you'll be able to tell what they're talking about. We're going to ensure that they have adequate hydration. So if they're intubated, they're not taking anything in by mouth. So what are we doing for them? Well, normally when there's an intubation, they normally have an NG tube, okay? And we can put fluids down the NG tube to, you know, just like a drink, just like, you know, we're giving somebody a drink. They could have IV fluids going, that would give them hydration as well. So we want to make sure that they're getting adequate hydration. We're going to support the client by spending extra time using touch and anticipating client needs. Okay, so we don't ever want to just go in and just be touching them with our gloves all the time, okay? If they're intubated, they want human interaction. Don't just say, oh, they're intubated, I don't need to go in there. Go in, talk to them, joke around with them, watch TV with them, do your charting beside them. You know, you can do all kinds of things, okay? When you're done performing your care, you're going to return the bed to the lowest position. You're going to take care of all of your equipment, okay? You're going to remove your gloves, and you're going to perform oral hygiene. And then you're going to document your procedures, your client's responses, and your assessment data in your client's record. So that is skill 1315, providing care for the client with an endotracheal tube.